He said, "Bad news, you've got cancer." And I said, "Really?" He says, "It's stage 3B colon cancer, and that's also not good." That was quite shocking, something I never expected. And he says, the good news is that we took it all out, so you're cancer-free from an observation standpoint. But because so many lymph nodes were malignant, we have to take the precautions. And the precaution is that, that you would probably need to go through chemotherapy. The first thing before the first visit to the infusion room was to meet with one of the trained oncology nurses and talk about all the side effects. Wow, she had a book that, I don't know, must have been 5 pages long of side effects that they were daunting. And after, it took me, I guess, 2 chemo sessions to figure out there were really 8 things that mattered to me. So of the 5 pages of symptoms, it turns out there were 8 that really affected me. And so I tracked all 8. I kept a table. It's a 14-day table because my chemo cycle was 14 days. I really encourage anyone going through chemo to consider putting together their own sort of table, their grid, however you want to map it out. It gives you a real sense of control, because the drug, otherwise you can feel like the drug's controlling you. But once you see that there's a pattern and a rhythm, then you kind of know where to push back and where to let it ride. At the last session of my chemotherapy with Dr. Dubosky, we talked about what's next. It's a 5-year surveillance program, and in my case it has 3 elements: colonoscopy, a CAT scan, CT scan, and a blood test for a particular blood marker that they look at. But what happened actually that really threw me off was that I began to experience numbness and tingling in my hands and my feet. And so where I thought I was going to be recovering, now I'm feeling like there's something, some complications setting in. And so I emailed the doctor and went and saw him in early August. He said, "No, this is totally normal. Things like this often manifest themselves after the full effect of the chemo has been, after the full 13 cycles of chemo have been applied, and that it almost always goes away." As it turns out, the numbness in my hands now is gone, and it's been I guess 11 months since the chemo ended, and I still have it in my feet. It doesn't affect me from a mobility standpoint. I can still play tennis, run, I can walk steps, but it is there. But the numbness and tingling in my feet is greatly reduced compared to what it was back in July. Well, one of the things that I guess I wish I would have known in advance was really how to sort of tell your friends what's going on. I still was a little reluctant to reach out. I wasn't calling for sympathy, but I thought that's what it would sound like. As a result of reaching out, I felt like I just garnished all this support. One of the other things that I discovered, and I'd encourage anybody who's going through cancer to really have an active dialogue with your oncologist about the side effects. I began to create a little log of the things that I wanted to ask him. It wasn't just things I wanted to ask, it was things I wanted to tell him. There's no reason everybody shouldn't do that. You've got to take the control yourself. You've got to actively communicate how you feel with your doctor.